name is Nicole Bruno, and this is task number 4, perform a microscopic examination of a blood film using the Leukocyte Differential. So first, this is my OCCI certification, which hangs on that wall right there. So I have my slide that I have already previously stained. It has a nice feathered edge and monolayer, which is where I'll be taking my readings from, my differential. So first you want to turn on your microscope. You want to face the slide on the microscope stand with the butt end towards the left side. So I'm going to do that. So first what you want to do is put it on 10-time power, the low power. Just going to take the glasses off. And you just want to do a general scan. You want to focus. You want to properly focus the microscope, make sure the lighting's okay. You also want to make sure that the slide, is properly stained. If it is not, you can go back and restain it. So I'm just doing my scan here. Okay. So now, of course, this is too far away to see exactly what types of cells they are. So then you want to go to the 40-45 power lens. This is the high-dry power lens. It's right here. Again, you want to refocus the microscope. I'm going to make sure it's in focus for you to be able to see. Okay. I'm just doing a scan, making sure I'm in the proper area. Okay, perfect. So I can actually see some white blood cells in this view. They are a little difficult to make out and tell which is what, but we will see that on the next step. So the next step is the oil immersion lens. So I'm going to take my immersion oil, which is right here. I'm going to apply 1 drop onto my slide here. Now again, you're reading in the monolayer feathered edge area. That's where the greatest diversion and distribution of cells is. So I'm going to now place it on the 100x magnification, or the oil immersion lens. And this is where I'm going to perform my differential count. So you want to refocus it. I want to make sure you're on the proper setting. Okay. Just trying to get a good area and a good fix on here. It can take some time. Okay, perfect. So I have a good view of my cells here. So before I go any further, I'm just going to describe some of the white blood cells and what they look like. So I have printed out a chart here. So these are some of the white blood cells. So you have neutrophils, lymphocytes, monocytes, eosinophils, basophils, So some of these are more common than others. Neutrophils are the most popular white blood cell. So I'm going to just see if I can zoom in here. So they are the most common, and the granules actually do not take stain. So they are pretty noticeable, and usually you see a lot of them per field. So there's also the lymphocytes, which have a large nucleus. They have a small amount of blue cytoplasm. They are not as common as the neutrophils, of course, but they are often there. The eosinophils are actually very rare. So these stain usually pink or red, and you would rarely see them on a slide. So I probably will not see any on this slide. Next we have the basophils, which look like that. They are also rare, probably will also not see any on this slide, and they usually stain blue-black with the stain, so they have a somewhat different look. The monocytes are actually the largest white blood cell out of all of them. They're easy to find on a scan because they are significantly larger than the other cells. And they also have this kind of horseshoe-like appearance. So lastly, there are the platelets. So the platelets they are significantly smaller than the white blood cells. They have a very distinctive look. Sometimes they are hard to find, but there's usually, or there should be, many of them on a patient's film. So what I'm first going to do is I'm going to start taking my differential. So I'm now going to begin counting my white blood cells on the side. So how we do this is we count, you want to in total count 100 white blood cells. You're going to count 10 per each oil immersion field. So I'm going to begin performing my differential and counting my white blood cells. So how you want to go about this is you want to read them on the oil in the oil immersion field, and you want to count 10 white blood cells per field until you reach 100. So first what I'm going to do is just list some of my white blood cells here. So neutrophil, and then I'll just keep tallies this way. Eosinophil, basophil, monocyte, lymphocyte. Okay? And I'm just going to keep a manual tally. I'm also going to have my platelets over here, which I will get to after. So I'm going to begin, and I'm going to take a tally. So let me find a good field. Okay. So I'm in a field on the oil immersion lens. I see 1, 2, 1, 2, 3, 4, 5. So I see 5 neutrophils in this field. So 1, 2, 3, 4, 5. I see 1 monocyte. Actually, I see 7 neutrophils in this field, 1 monocyte. See 1 large number of platelets, but we will count that after. And I see 2 monocytes. So right now I have 5, 6, 7, 8, 9. And you know what? That one in the corner up there is also a neutrophil. Okay. So in my one field, I have counted 5, 6, 7, 8 neutrophils and 2 monocytes. So now, since I've counted 10 in that field, I'm going to go on to the next field and count 10 more white blood cells and continue this process until I have 100. So I have finished counting my 100 white blood cells on my microscopic blood film slide. So I have come up with my tallies here. I have seen 85 neutrophils, 5 monocytes, and 10 lymphocytes. So now, from here, you want to know any abnormalities that you saw, anything out of the ordinary. I did not see any abnormal cells on this slide. I am next going to look at the platelets and see if any of them appear abnormal. On this slide, there are a large number of platelets, so I'm going to go ahead and start my count there. So I'm now performing my platelet estimate. I'm counting the number of platelets per high-powered field. So I have seen about 15 platelets per high-powered field. Sometimes it ranges up to 20, but it's about 15. So in order to do my platelet estimate, I'm just going to get my calculator. So I'm going to do 15, which is how many I saw per high-powered field, times about 15 to 20,000. So just say do 15 times 20,000, and I get 300,000 platelets per microliter of blood. So that would be my platelet estimate for this microscopic blood film. So I'm just going to explain how I calculated the absolute values of these white blood cells. So what you're going to do is you want to take the total white blood cell count times the percentage of the differential for each type of blood cell. So fairly straightforward. If there are 85 neutrophils, the absolute would be there are 100 white blood cells total, which I counted, and then it'd be times the percentage, so times 0.85, which equals 85. So for the monocytes, there were 5. It would be 100 times 0.05, which would equal 5. So 100 times 0.05, 5. And then lastly, the lymphocyte would be 100 times 10, which would be 0.10%, and that would equal 10. So that is how you would do that, and that is how you would take the absolute values. So there are various causes and reasons as to why a white blood cell would be increased. So for example, a neutrophil, increased number of neutrophils can indicate a bacterial, fungal, or any other sort of infection. So what's happening is the body is trying to fight off the infection, so the neutrophils are actually increasing. So sometimes there would be an alarming amount of neutrophils. That could indicate that there was possibly an infection somewhere. So this about wraps up our microscopic examination of a blood film and performing a leukocyte differential.